So hi to all the viewers who have joined. So today I'm Dr. Karthik, Endocrinology faculty in Doc Tutorials. So today I'll be giving you a brief overview of the specialty of endocrinology, and those who have decided to join endocrinology, what are the points that you need to keep in your mind while selecting the college in your uh, dream specialty. So why endocrinology? So that many of you must have a lot of reasons for behind why you are going to choose endocrinology. It could be because you might be interested in the subject once you have read the topics from Harrison. It could be because of your posting in your college where the endocrine department is so good in working up cases and you must have been interested in that. Or it could be the paucity of interventions associated with the specialty, because this intervention is a two-edged sword, I would say. Because I've seen Dr. Prashant sir talking about medical gastro uh, yesterday, and he has specifically mentioned about the interventions, because some of the students may be very interested in an intervention based specialty, and there is an other extreme to it also. There are a subset of students, mine included, while doing the medicine, where you must have a feeling that I'm not very good at this intervention side. So I'm in the future, I'll be opting for a specialty which has got less number of interventions, could be endocrinology, could be rheumatology, like that. So there are umpteen number of reasons which must have prompted you to choose this specialty. So here I'll not be giving a rank list of the colleges in any specific order, because the criteria of a good college or an ideal college differ from person to person. So the priorities of each student is different. So some may give more importance to academics, some may give more importance to the proximity to their home, some may give more importance to the presence or absence of bond. So it is virtually impossible to have a unified ranking of all the colleges and which is applicable to every student out there. So what here I am going to give is an outline of, if you have decided to join endocrinology, what are the points that you specifically take into account while inquiring about the colleges. Honestly, I'll be speaking out what all difficulties or what all inquiries I had in my mind when I wrote the NEET SS exam and when I was trying to opt for a specific college. So I'll be trying to answer those queries, and you can type your questions or queries in the chat box and I will answer each one of them. So the possible questions which could be in your mind at this point of time is, should I take endocrinology? Is it worth it? So already it has been 2 weeks since the NEET SS results has come, and majority of you, I presume, must have made a final choice, whether it is endocrinology, cardiology, neurology. And I still believe that there are still a few of you who are still not very sure about what is the ideal specialty suited for you. So those who have decided, or those who have considered endocrinology must have a feeling, is it worth it? That is the first question. And those who have decided to take endocrinology, whether DM or DrNB should be the preferred one. And third, which college, if you are choosing DNB, which college, if you are choosing DM, which college, and what are the points to be kept in mind. So I will try to answer these points in the next 10 or 15 minutes. So first, should I take endocrinology? Still, there are some students who have messaged me raising their concerns. Sir, is there enough opportunity for endocrinology? Or is endocrinology caseload confined to diabetes and thyroid disorders alone? And currently, most of the cases are being managed by physicians. So if I pass out and start practicing as an endocrinologist, will I get a good amount of patient base? These are genuine concerns which are arising in the mind of students. And these concerns I also had in my mind a few years back when I wrote my NEET SS exam. So the first question, so the diabetes and thyroid disorders, of course, form a major chunk of what we see in our practice once you pass out DM endocrinology. So even if you take other specialties like neurology or cardiology, you will be learning about a wide spectrum of diseases. But it is not that you see each one of those cases in your day-to-day practice. For example, a practicing neurologist will not be seeing a motor neuron disease or a Duchenne muscular dystrophy on a daily basis. So those will be once in a blue moon phenomenon. So most cases they would be encountered is a post-stroke sequelae, or it could be a migraine headache or other headache disorders, could be chronic fatigue syndrome, like that. So likewise in endocrinology, there are numerous disorders that you are going to encounter in your 3 years of training. So diabetes and thyroid, I would say, are the two conditions that you learn least during your 3 years training. You will be focusing all your attention to other conditions, to the adrenal, the pituitary, the neuroendocrine tumors. All such interesting avenues are there, which are really unexplored as far as an endocrinologist is concerned. So diabetes and thyroid, they do make up, because of their commonness, they do make up the major chunk once you start practicing, but endocrinology is not confined to diabetes and thyroid disorders. Second point, whether we will get adequate number of patients once we start practicing, because what we see, the current trend is today is that most of the diabetes mellitus and the thyroid disorders are being managed by the physicians. So let me take your attention some 10 or 20 years back, where there were not enough cardiologists, not enough gastroenterologists in our country. In those situations, the stroke patients, the chronic liver disease patients were all looked after by the physicians. But the scenario has changed once there were enough specialists available in every nook and corner of our country. It is exactly the same with that of endocrinology. Now the population is becoming more and more aware that there is a specific subspecialty that are concentrating on the diabetes and thyroid disorders. And now what the trend I am seeing across the country is that the people are specifically asking for endocrinologists for management of these conditions. So that would ultimately lead for the hospital management to hire more of these specialists rather than allowing the physician alone to look after these cases. So of course, there is a huge unexplored areas within our country. There are a lot of cities in India still lacking an endocrinologist. So I would say there is a huge opportunity which is ahead for a newly passing out endocrinologist, and there will be no dearth of clinical caseload or patient number. So that is the second one. Third, do I need to study a lot of pediatrics? Of course, if you go through the Williams endocrinology, I think some of you must have. So there is a dedicated section on pediatric endocrinology, and I must admit that a number of cases that we see and encounter in our 3 years of training is related to pediatrics. It could be based on short stature, pubertal disorders, Turner syndrome, growth hormone deficiency. So a lot of pediatric cases are there, and it is not that you should learn pediatrics from A to Z. So you can have, there are specific focus areas which you will be taught by your seniors as well as your teachers on what all areas to be focused while dealing with these cases. And it doesn't mean that you have to learn the entire pediatrics, the entire development, diet, everything. You have to learn only the basics. And I don't think learning the pediatrics should be an hindrance for a person opting or who are aspiring to take up endocrinology to leave that seat. So of course, you will have to study some amount of basic pediatrics and those core areas pertaining to each of the cases, but that will not be a problem. Once you are deep into the endocrinology specialty, that won't be a problem. And I've not seen even a single person who have said that I'm finding it difficult to cope with the pediatric aspect of the endocrinology, because more than 90% of the residents who are taking up endocrinology every year has come from a background of general medicine, and still they are finding it easy. It is just final year MBBS pediatrics that you have to brush up and nothing more in a MD pediatrics level. So the prospects after DM or DrNB, again, you can have an academic life after that. You can have a research oriented, you can have a patient based, and you can have, just like other specialties, there are specific fellowships available abroad also. So all those avenues which are there for other specialties is there for endocrinology also there. So there should not be any room for concern once you pass out your DM course. First, DM or DrNB. And before that, one of the questions have popped up in the chat box. Dr. Parth has asked, till what rank we can expect DM plus DNP seat in endocrinology? So first thing I have to say is that this year it has been different, unlike the previous years where there was a specialty based exam. So if you look at the counseling and the allotment list of the last few years, it was an endocrinology only ranking. And based on the seat metrics released in 2021, there were around 105 seats for endocrinology available, excluding those colleges which are affiliated to INI, the AIMS, PGI, JIPMER. Excluding all that, there were more than 100 seats available for endocrinology. So, but the problem is that only around 70 to 80 out of that 100 are genuinely good. The remaining 20, I'm a little bit apprehensive, is because in certain colleges which I've come to know of, is that there are no specialist endocrinologists. And endocrinology OPD has been running for quite some time, and the MCI has granted endocrinology seats. So I'm a bit apprehensive regarding some of those colleges, and which has been, some new seats have been approved this year also. So I'm not going to mention the names of those colleges. So I'll be giving my contact number. Those who are having some doubt can directly contact me. So coming back to the question, so if you go back to this allotment list of the previous years, up to 100 definitely, because there are 100 seats, up to 100 in the specialty category you will get. But all that depends on, out of your rank in the common rank list, how many are preferring endocrinology above you. So that varies from year to year. So I've seen the topper interviews and I've personally talked with some of the toppers this year. And if you take the top 20 ranks this year, and I'm sure that at least 6 or 7 are choosing endocrinology. But I cannot extrapolate it to other ranks. It could be a trend seen in the very top rankers only. It may not be true. If you take around first 100 or first 200, the previous thought process was that 1 in 5 will choose endocrinology. But again, that doesn't hold true in all respects. So if you take that 1 in 5 rule, that if you say that if 1 out of every 5 students would opt for endocrinology, if you consider that to be true, you can say that up to 500 in the general rank list would be getting endocrinology easily. So again, I would say the ranks between 400 to 500, the colleges that you would get, you will have to be very cautious. You will have to speak with the person who are doing the DM or DNB there, and you have to personally speak with them, and we have to inquire specific points regarding those colleges, and I will mention what all those points are. So I think, Parth, I've answered your question. Up to 500 is my bet, but again, that varies because some of the colleges in the seat metrics are having very high fees. For example, 10 lakhs per year in St. John's, around 20 lakhs in Amrita Institute of Medical Sciences. So that may also detract certain students from taking the seats. So up to 500, you can get a seat, but at that seat that you're getting, there may be some issues like the bond issues, the fees issues. So you'll have to have a personalized approach. Now, what are the points to ponder while choosing a college? First is the OP caseload. I don't think that would be a problem in any of the colleges out here. In most of the colleges who has had an endocrinology department running for more than 5 years, so they should have an adequate OP caseload. And because there are not many endocrine centers across the states, in almost all the states in India, most of them would be referral centers, and they would be getting referrals from far off places also. So the OP caseloads is not going to be a problem. Sometimes in a super specialty, multi-specialty private hospitals which are offering a DNB course, there sometimes the OP caseload could be an issue, where the referral of rare cases from far off poor families, they are preferentially will be going to the government institutes where they will be getting treatment for free. So regarding that aspect, sometimes I've seen DNB candidates from certain colleges which have personally spoken to have mentioned that there is dearth of certain rare cases which are not being seen in their OPD. So apart from that, if you consider the total OP caseload, it is not a problem anywhere usually. Then regarding the number of inpatient beds, so some of the colleges were allotted seats only 1 or 2 years back. So many of them were having an endocrinology OPD running for a few years, based on which the MCA has granted the seats. But you have to make sure that at least around 10 to 15 inpatient beds are there, because even though the general conception among the medical students and some of the other specialty doctors is that endocrinology is strictly an OPD specialty, it is no way true. You will have to admit the patients for management as well as for detailed evaluation process, and you will have a lot of dynamic tests in endocrinology where the patient will have to stay with you for a few days to complete those tests. So it is important that you have to have enough number of inpatient beds for carrying out those investigations and also for planning management. So at least 10 beds is mandatory for a proper functioning and workup of endocrinology patients. Third, regular academics and number of faculties. So the MCA has actually laid down a guideline for how a proper academics should be run. And I think most of the colleges across India are adhering to those guidelines. For example, at least 3 academics, 1 clinical case discussion, 1 journal club, and 1 case presentation, and 1 topic presentation. These are the typical 3 academics which are being carried out in many colleges. And also important is the number of faculties. So if the department is run by a single faculty, then it may be difficult for you to get maximum out of that person or to get maximum academic exposure. So higher the number of faculties working in the department, higher will be the discussions going on, and you will have a lot of perspectives coming from different qualified persons, and that will only help you to get better and better. So that is the third thing, the presence of regular academics. And fourth is the presence of an in-hospital or departmental lab with hormonal assay facility. It's an extremely important point because many of the colleges still doesn't have a properly functioning departmental laboratory. Because endocrinology, it largely depends on the values of these results. So a basic facility for doing an chemiluminescence or electrochemiluminescence based testing should be available, and if it is available, that is a huge advantage to that department. So but even there are certain colleges who doesn't have an in-hospital laboratory, but they are outsourcing the investigations to a private lab and getting good results also. So if such process is already set and running there, then it is good. But it is always better to join a college with an in-hospital hormonal assay facility. So why I am listing out all these points is that you have to have a contact with a person who are already joining. You must have a short list of colleges which you are planning to join, and you should contact a person who are already doing residency there. So once a person is doing the residency there, so suppose you are calling a second year or third year resident on that college, they are already very much accustomed to their working practice, so that they may not be able to point out the deficiencies or advantages because they are so into their, or they are so inculcated into their working routine, so that they may not be able to specifically point out the deficiency or advantage. So unless you are able to specifically ask these questions to that individual, you may not get the required answer. So after getting all the answers for all these questions, you may have a ranking for yourself. I've said the priorities change from student to student. So you can have a rank list of your own based on these points. So these are the first four things. Then the other ones is the exposure to pediatric endocrine cases. It is extremely important. What I've already said is that there are many pediatric cases that you need to learn during your residency. So you have to make sure that there are adequate number of pediatric patients also being referred to your department. 6, permission to attend conferences and competitions. So this is one point, because there are certain institutes, I'm not going to give the names of any institutes because the workload is so high and the residents form an indispensable part of their workforce. So they may not relieve the residents for attending conferences for even a day or two. There are colleges like that. So you have to make sure that, so endocrinology is unique in such a way that there are lots and lots of teaching conferences going on. There are lots of competitions for research as well as academics going on for the students. So you have to choose a college which gives permission to attend these conferences, and of course the presence of a good research facility and culture, the good clinical research work from the department, from the previous publications from the department, and is there funding available for those researchers, and also these also matter. And also presence of a good nuclear medicine and radiology departments, because the endocrinology is largely dependent on other subspecialties also, like nuclear medicine, because you will have to do a radioiodine scan, technetium scan, PET scan, FDG or dotatate PET scan, and you have to do an MRI cella, CT abdomen for adrenal, for pancreas. So all a good departments available in the in-hospital fashion would be very beneficial for endocrinology residents also, because they can have good discussions. In our college, we used to run regular endo radio club, endopathology conferences, endocrinology, nuclear medicine conferences, where the faculties from different departments as well as the residents interact, so that, and they will discuss the interesting cases. So that will make the learning and academics much more interesting and fruitful. And you must have seen neurologists. They will not rely on the report given by the radiologist, because they have a clinical picture. They have seen the patient. They have a clinical picture of what is likely going to be the abnormality in the MRI, and they will specifically look for that. The same can be said for an endocrinologist also. So in the first year itself, you will learn to read a CT abdomen. You will be reading an MRI brain and MRI cella. And even without seeing a report, by second year or third year, you will be able to make a diagnosis based on the image itself, because you have already seen the patient and now you know what is going to be there in the image. And thus an approach would make you well versed, at least in your cases. You would be able to identify pituitary adenomas, craniopharyngiomas, adrenal lesions, pheochromocytoma, pancreatic tumors. All those you will be well versed. And for that, you need to have a good mentorship in the form of a good radiology teacher, a good nuclear medicine faculty. So if you are working in such a setup, that would be a huge benefit for you. And next, language. There are a lot of good colleges in West Bengal, in the southern India, but I have seen students, despite ticking all the boxes, they are not willing to choose those colleges just because of the local language barrier. Because the large number of patient load which is coming to that hospital will be speaking their native language, and sometimes learning a native language like Malayalam in Kerala or Bengali in West Bengal may be difficult for a non-resident. So that may also you have to take into account. So that is the reason why persons always tend to choose the college where they are able to understand the local language. And very important point is the number of DM or DNP residents. So this is one point that goes against choosing a DNP seat, because many of the colleges that offer a DNP seat runs with only one seat. Many of the colleges, if you look at the seat metrics, so that is a huge disadvantage. From what I have, from the whatever details I have spoken to the residents who have studied there, because a large work thing will be dependent on you only. So you may not be able to get leave on the required days. So working as a single resident, be it DM or DNB, I would say is a big disadvantage for you. And coming to the comparison, just a comparison between DM and DMB, a trend over the last 2 to 3 years says that top 50, top 50 rankers in endocrinology have chosen DM, and the DNB has been chosen only after that. There are certain outliers also, but the trend over the last few years was like this. Top 50, they have all, I'm speaking about the endocrinology subspecialty ranking. Top 50 endocrinology students have opted for DM, and the DNP was opted only after 50 ranks. So that would say about the preference which is given by the candidates to DM and DNP. But now the scenario has slightly changed, because some of the colleges which were not strictly enforcing the bond have now started to do so. And many of the top institutes like KEM, SGPGI, they are enforcing 2-year bond. And to make the matters worse, the SGPGI, for example, you will have to do a 2 years bond, and that bond, you're no way sure that you will be doing your bond period in the college itself. There is a specific counseling for that. So you may have to do your bond in a peripheral hospital setup without practicing endocrinology. So that is what I presume. So that is a huge disadvantage. So bond period also, even though I have put it as the last point, it could be the one which makes you choose or which makes you reject a seat. Even if you are getting a good rank and you are eligible for a seat in a top institute, the presence of this 2 or 3 years bond would be a large deterring factor which would prevent you from taking the seat. But again, you will have to consider your personal situation, your family situation, whether you will be able to spare another 1 year or 2 year after completing your 3 years course. Again, that is all varies from individual to individual. And one also important thing is that whether you will be able to complete your bond in that institute itself, that also is very important. So doing an additional 1 year bond in a reputed institute doesn't harm you much in respect of academics as well as research, because you will be able to work there as a faculty, enhancing and enriching your academic exposure as well as research exposure. But if you are sent off to far off places to do your bond, I would say that is not a preferable choice. Again, that is the reason why people are opting for colleges with no bond. For example, UCMS Delhi and the Banaras Hindu University, BHU, also have these are one of 2 colleges which suddenly comes to my mind, which has got no bond. Of course, there are other colleges also, and the DNB, the institutes which offer DNB also have no bonds attached to it. So that makes these colleges an attractive option. So last but not the least, you will have to speak with the residents who you are planning to join a college. You will have to know about a detailed knowledge about the working environment there, whether what is the approach of the faculties, are they providing a good academic and research environment. It is imperative to have a small talk with the resident who is already doing the course there. So I hope these are all the points that I would like to highlight: the caseload, the inpatient beds, the academics, the hormonal assay facility, pediatric cases, the conference attending, the provision for research, interdepartmental collaboration, the language, the number of DM residents, and finally the bond. So to answer your queries, I'll be always be happy to respond to your queries, and regarding which college to select and certain other priorities also, it is best discussed in person, because I have a lot of limitations to point out the advantages and disadvantages of each college in this public platform. So I can talk to you in person if you message me regarding any queries. And Dr. Mohammed Lukman has asked, so what is a priority list of South and North colleges? So I don't think there is as such any distinction between South and North colleges. There are, of course, colleges in Mumbai, in Uttar Pradesh, who have got a lot of years history, well established endocrine departments are there, like KEM or SGPGI. So automatically the students will have a liking to those colleges. And I don't think there is a if you again, what is a priority list? If I am asked that question again, that there is no single factor with which you can make a priority list. It depends on the academics. I can say an example, like in KEM or SGPGI, I have mentioned the there is a very good hormonal assay. The academics is fine. The caseload is very good. There is great exposure to pediatric endocrine cases. But again, the point is there is 2 years bond. Some people may find it okay to have a 2 years bond after the course, but some persons will not have that open-mindedness. So they may not find it liking to have to work for another 2 years once the course is over. So again, that is largely differs from person to person. And if you can message me personally, I'd be able to point out the advantages and disadvantages of each colleges. And how is the passing rate in DrNB endocrinology? And regarding the passing rate, I would say it has improved over the last few years. So about 5 years back, there is only 5 or 10 years back, only less than 50% pass rate is there. But now, from whatever I have talked with my seniors and all, if you perform well in the exam, there is nothing preventing you from passing the exam. But again, DM endocrinology would have higher pass rates compared to DrNB. That is what I know. But again, that gap is being bridged over the last few years. And Mohammed Lukman is again asking, is DM better than DNB in endocrine? It is not because of the label of DM or DrNB. It is largely dependent on the institutes which are offering the courses. Suppose if the top institutes are going to offer DrNB from tomorrow instead of DM, then DrNB would become the preferred choice. So it largely depends on the institute which are offering this rather than the course name, whether it is DNB or DM like that. So any other queries, you can type in the chat box. So if there are no queries, I'd like to sign off, and it's been a pleasure to interact with all of you. And I would always be available on WhatsApp. You can type in all your queries regarding the apprehensions that you have before choosing endocrinology, what college what are the shortlisted colleges, and I will help you in choosing out the college from your shortlist you have, and pointing out the advantages and disadvantages of each of the college. And that's it. Thank you.